Hello everyone, and welcome back to the channel. Today, we have some serious news coming out of Ethiopia that we need to talk about. The Ministry of Health has officially confirmed an outbreak of hemorrhagic fever in Jinka, a town in the South Ethiopia regional state. This is a developing situation, and it's crucial to have the most accurate and up-to-date information. So let's break down what we know so far. According to a statement released on Wednesday, health officials have identified 8 suspected cases of this illness. Now, it's important to understand what hemorrhagic fever means. It's not a single disease, but a group of illnesses caused by several different families of viruses. Some of the most well-known ones include Ebola, Marburg, Lassa fever, and Crimean Congo hemorrhagic fever. They are often characterized by symptoms like fever, muscle pain, and headache, which can progress to more severe symptoms, including bleeding or hemorrhaging from various parts of the body. This is why these outbreaks are taken so seriously by health authorities worldwide. In response to these suspected cases, the Ethiopian Ministry of Health has acted swiftly. A rapid response team has been deployed to Jinka. Their mission is multifaceted. First, they need to figure out the exact cause of the outbreak. This involves collecting samples from the patients and sending them for detailed laboratory testing. Identifying the specific virus is the most critical first step because different hemorrhagic fevers have different transmission methods, severity, and treatment protocols. Knowing the enemy is half the battle. The second part of their mission is containment. They are working tirelessly to prevent the illness from spreading any further. The official statement from the ministry highlighted that they are undertaking coordinated surveillance and response activities in collaboration with various partners. This isn't just a government effort. It involves a network of health organizations working together. On the ground, this translates to intensive community-level monitoring. Health workers are going house to house to find any other potential cases that might have gone unreported. This active case finding is essential to get a true sense of the scale of the outbreak. Another key component of the containment effort is contact tracing. For each of the 8 suspected cases, the response team is trying to identify every single person they have come into contact with. These contacts are then monitored for symptoms. This is a painstaking but vital process. It helps to break the chain of transmission by isolating people who might be infected before they can pass the virus on to others. At this moment, the specific type of hemorrhagic fever has not been confirmed. The samples are currently being analyzed, and everyone is anxiously awaiting the results. Until those results come in, authorities are treating this with the utmost caution. It's a situation of prepare for the worst, hope for the best. The uncertainty adds a layer of complexity to the response, but the protocols being followed are designed to be effective against a broad range of potential pathogens. So, what does this mean for the people living in and around Jinka? The Ministry of Health has issued clear advice for the public. They are urging residents to seek immediate medical attention if they experience any suspicious symptoms. These include unexplained bleeding, a sudden high fever, severe diarrhea, or vomiting. Early detection is key to improving a patient's chances of survival and also for preventing further spread. The message is clear. If you feel sick with these symptoms, don't wait. Go to the nearest health facility. Public health is a shared responsibility, and the ministry is also emphasizing the importance of personal hygiene. They are advising everyone to practice strict hygiene, especially regular and thorough hand washing with soap and water. This simple act can be incredibly effective at preventing the transmission of many infectious diseases. Additionally, people are being advised to avoid direct physical contact with anyone who is showing symptoms of the illness. This includes avoiding contact with the bodily fluids of sick individuals, which is often how hemorrhagic fevers are transmitted. The response isn't just happening at the community level. Health facilities across the entire South Ethiopia regional state have been put on high alert. They have been instructed to strengthen their screening procedures for all incoming patients. This means they will be actively looking for individuals with symptoms that could indicate hemorrhagic fever. If a suspected case is identified, the protocol is to immediately isolate the patient to prevent any transmission within the hospital setting. These facilities are also required to promptly report any new suspected infections to the Central Health Authorities, ensuring that the response team has a real-time picture of the situation as it evolves. The government has promised to provide further updates as soon as the laboratory results are available. Transparency is crucial in situations like this to prevent panic and misinformation from spreading. We'll be keeping a very close eye on this story and will bring you any new information as soon as it is released by official sources. It's a reminder of how quickly public health situations can emerge and the importance of having strong, responsive health systems in place. Let's think about the broader context here. Ethiopia, like many countries in the region, has experienced dealing with infectious disease outbreaks. This experience, while hard-earned, is invaluable in moments like these. The rapid deployment of a response team and the implementation of classic epidemiological tools like contact tracing and community surveillance show that the system is kicking into gear. The collaboration with partners is also a positive sign, as it brings more resources, expertise, and manpower to the table. For those of us watching from afar, it is a moment to send our thoughts and support to the people of Jinka and the healthcare workers on the front lines. These workers are putting themselves at risk to protect their communities, and their dedication is truly commendable. It's also a powerful reminder of our global interconnectedness. An outbreak in one part of the world can have implications for all of us, which is why organizations like the World Health Organization play such a critical role in coordinating international public health responses. We'll continue to monitor the official channels from the Ethiopian Ministry of Health. The key questions that need answers are: what is the specific virus causing this outbreak? How is it transmitted? And are the current containment measures proving effective? The answers to these questions will determine the next steps in the response. It's natural to feel concerned when you hear news like this, but it's also important to rely on information from trusted sources and to avoid speculation. The authorities have a plan in place, and they are executing it. For now, the best we can do is stay informed and hope for a swift and effective resolution to this outbreak. Our hearts are with the affected individuals and their families. Thank you for joining me for this important update. We believe in providing clear, responsible reporting on global health issues. If you found this information helpful, please consider liking the video and subscribing to our channel for more updates. And please, share this video to help spread awareness based on factual information, not fear. Stay safe, and we'll see you in the next one.